Initially, I wanted to be a nurse. I decided that healthcare was where I wanted to be because I wanted to help people. And then got a little more into my major and realized radiology was more where I aligned with. So I chose radiology as my major in college and started radiology school and realized that the imaging aspect of it is really interesting. We see new stuff every day. It changes every day. My name's Jessica. I've worked with CMH since 2011. I've been a registered radiologic technologist since 2011 and registered as a computed tomography technologist since 2014.
In radiology, there's quite a few options for different modalities. I started in radiology as an X-ray tech, which is generally how people get into the field. Once you become an X-ray tech, you have some options to branch into other modalities, to either cross-train or go to specialty schools. My name's Christy. I'm a registered diagnostic medical sonographer. I'm registered in abdomen, OB, and GYN, and also registered vascular tech. I'm also a registered X-ray tech. I started in radiology in 2007, worked for about 4 years as an X-ray tech, and then the last 12 I've been an ultrasound tech.
Honestly, I chose X-ray because every day is kind of like a puzzle. So you'll get patients that, let's say one comes in through the ER with a broken arm. You have to get the best views possible with what the patient can do. So you have to think outside the box, what's going to help the patient and the doc help them get better. My name is Ben French. I am a radiology tech at CMH. I've been doing X-ray since 2019.
MRI uses your body and radio waves and a big magnet to take pictures. We can image any part of the body. They average about 20 minutes. And they're very detailed pictures and can help the doctor diagnose the problems. My name is Amber and I am an MRI technologist at CMH. I've been registered in radiology and MRI since 2000.
My typical day is going to change depending on the day. So I could have a day where I'm just doing a bunch of portables. I could have a day where I have fluoro cases, where I have surgery cases. Honestly, it just depends, because I mean, even with portables or inpatients, I go all over the hospital.
So a typical day for a sonographer, we're going to review patients' history, look at any prior imaging they have before we get them for their appointment, any pertinent information in their medical record that we need to check into, and then we scan the patient, take images. When we're done with that, we also write a report for the radiologist that just gives our impression of what we saw during our scan. We know any major abnormalities or anything that we want the radiologist to pay special attention to.
I work at the hospital and the outpatient imaging center. We do several MRIs a day, taking either inpatient or ER and outpatient. We just take pictures and diagnose with our images, and we're very busy. We have several patients a day, and we have scanners at both facilities, here at the Douglas building and the hospital.
Most days I'm doing a full schedule of CTs, which involves 25 to 30 a day, depending on how busy we are. We do a lot of contrast studies, so we start IVs, do contrast injections, and then do the CT scans. And then we'll discharge the patient, take the IVs out, and send them on their way to get the results of their doctor. I like that it changes every day. I see something new every day. You know, the human body is different for everybody, so the anatomy can even be different, and it's just really interesting to see the insides, to see what's happening in there and get patients' diagnosis.
I like radiology. I like to help people. I think imaging is very important. I know that people, when they come in, they're hurting and they have problems, and it's hard for them to do, but I like to help them find the problem. Even I don't want people to have a problem, but we can help find the problem, help it get a resolution with their symptoms.
So I choose to stay in this field because of the people. I've had other jobs to where, even in, let's say in retail, where it's supposed to be people oriented, this one is more satisfying to help people out.
So one of the things I love about radiology at CMH is my coworkers. My coworkers are my family. We're very close. Radiology is typically a pretty small department. Even in bigger hospitals, it's a fairly small department, so you get to know your coworkers very well. So we are kind of just a family here, and it's very close-knit here. I also really like the fact that I'm always learning. Even after 12 years of doing ultrasound, I still see new things. I still see things I don't recognize, and I can go talk with my radiologist on it. So I'm learning every day.